Rheumatoid arthritis, type 1 diabetes, and multiple sclerosis. Those are some of the most common autoimmune diseases, and that develops when your body's immune system attacks healthy cells. But there are treatments that can help people suffering from autoimmune thyroid disease. And here to explain those options is Dr. Joshua Red. He's a chiropractic physician from RedRiver Health and Wellness Center. Great to see you.
Thanks for having me.
What is the most common low thyroid disease?
The most common one is a disease called Hashimoto disease, which you mentioned, and that's where your immune system, instead of attacking bad things, is now starting to attack its own tissue, and in this case, the thyroid tissue.
And so Hashimoto's, it's a big term, you know, that we're hearing a lot about. What are some of the symptoms that you're going to experience if you have that?
If you have it, you're going to have depression, fatigue, weight gain, intestinal problems. You might feel like you swell, brain fog, decreased clarity, hair loss. I mean, there's so many different symptoms. I mean, this impacts the body so drastically, and most patients don't really understand what's causing their low thyroid to begin with. But in most cases, we're finding out that it's actually Hashimoto's.
So what are some of the other diseases that can accompany Hashimoto's?
That's a good question. When you have your immune system attacking one tissue, the likelihood of it attacking other tissues in the body is great. And rheumatoid arthritis is one of them. Celiac disease is probably the most common, but you can end up having a slew of other autoimmune responses occurring, and it's causing the patient's life to just be miserable.
And speaking of slew of, you go to doctor after doctor after doctor. You're either misdiagnosed or you're not diagnosed, either misdiagnosed or maybe they don't feel like there's something wrong with you. Why is it undiagnosed so often?
Autoimmune conditions are really tricky because there's so many different things that will cause it to trigger. And so if somebody has or is suffering from an autoimmune condition, they might have 7 to 10 different triggers that cause it to flare up and destroy tissue.
Okay.
They also might have dietary and lifestyle things that cause it to flare up. So if we just work on 1 or 2 things, the patient's likely not going to feel any better. And so you really have to spend a lot of time with the patient, do the proper tests needed to identify the triggers that cause it to flare up, and then really work with the patient hand by, holding their hand throughout the process, teaching them and educating them and going that route. I mean, we work with lots of doctors in conjunction, but learning how to really calm down the autoimmune response is huge.
And for those who are watching right now, who maybe have been to a number of doctors, who maybe are on medications for certain things that it's still not working, walk us through an appointment at your office.
Okay, that's a good question. Well, first off, dietary, diet, lifestyle, and nutrition can have a dramatic impact on somebody's autoimmune response, and there's mounds of research to show that. So when patients come in, we want to do a very extensive blood test, more detailed than what they're probably used to, and try to identify certain triggers that cause it to flare up. They might have blood sugar level imbalances or cortisol defects or intestinal problems or something as simple as a bacterial infection that will cause autoimmunity to flare up. They also might have food intolerances, like whatever it may be. Everyone's different. We don't want to treat the patients the exact same. We want to make sure that we're really customizing a specific treatment plan for that patient. And as we identify those triggers, then our goal is to basically go in and try to improve each one as best we can, and walk them through that process as well.
When the patient is finished, how do they feel? What is the reaction?
You can't cure an autoimmune condition, and so our goal is to have a patient go from, they might have 0 to 5 good days a month to 20 good days a month. But it's different, because now instead of being confused and frustrated, they're now empowered and they have control of their condition. And when you can go from 5 good days to 20 good days, that's a significant improvement.
That is a significant improvement. Let's let you get some healthy results now. RedRiver Health and Wellness is offering Sonoran Living viewers a free consultation. To book your appointment today, call 480-970-5555. Plus, you can download a brochure and view testimonials at lowthyroid101.com.